Hello, my name is John Nelson, and I would like to take the next few minutes to talk with you about an international project about studying models of care around the globe. You are using the model of care referred to as relationship-based care or are working toward implementing that model. It is also referred to as RBC. We are doing this project in collaboration with Creative Healthcare Management, the world's expert in relationship-based care. Recent large studies has revealed that patient outcomes have not improved very much over the last 10 years. Much of this lack of improvement is due to not structuring the data according to the model of care that is being taught to employees and implemented operationally. Thus, we would like to ask you about your work environment, both socially and technically, how you care for patients, how you care for yourself, and select patient outcomes. Over the next few minutes, I will review with you how you can participate in this study.
On the day the study launches, you will receive this link from someone within your organization, or you will be directed how to access this link from within your organization's intranet system. Now, once you enter the survey portal, you will need to enter some information to access your private survey that nobody else will have access to. You'll need to enter your last name, and I'll enter a test name here. Enter your first name as well, along with your employee code and the name of your facility. Now, it should be noted that organizations that use this intranet process do so because they would like our company to conduct more complex analyses of the data. Examples of analyses include within subject and interaction effects, which help us to understand how employees change and evolve over time. If you'd like more details about the methods, contact us at Healthcare Environment using our contact page. I will note that Healthcare Environment uses only HIPAA-compliant methods, and your responses will always remain confidential. We report group data only and not individual data. Now, if you do want a copy of your individual responses sent to you via email, provide that email here. Now, nobody else but you will have a copy of these responses, but we do suggest sending yourself a copy for your records, for individual action planning, or so you can see how you compare to everyone else in your unit or hospital or organization. Now we'll proceed to the survey. And you see on this particular page there's some extensive directions. Now, not every survey will have extensive directions like this one. There's some consent in it as well. So we'll page down to the bottom, and there you see we will select to continue. Now, when we do go to the next page, there is also one sentence of direction for this page. Now, each page may or may not have directions for that respective page. Now, we'll proceed to respond to each of the items. Some will be Likert, some will be demographic, some will be text. Now, there may be a question that you feel uncomfortable responding to and you want to leave it blank. So we're going to do that here so you can see how to manage unanswered or responses that have been left blank. We'll respond to the demographic, and then I'll just provide a couple words for text as a sample for you. And then you note at the bottom I have an option to either go to the previous page to continue or to save and return to this survey, but I'm going to continue. And you'll note that I'm prompted to go back and answer question 7 because it was blank, but I already know that and I want it left blank, so I'm going to continue. Now, when you do arrive at the last page, you see that there's again 3 options to either go to the previous page, to save and return later before submitting, or I can submit. And I am satisfied with my responses. I'm going to submit knowing that I cannot return to this survey once I submit.
Now, if you don't have a printer available at the time that you complete the survey, or you'd rather not print it off at the time that you complete the survey, the other option for you to find your results is to go to your email using the email address that you provided for us at the beginning of the survey. You can download that and utilize those results for you to do some individual action planning for change, or to use to compare your results to those of your coworkers on your unit. Now, this next section I would like to talk with you about how we will use the results not only individually for action planning or in your hospital, but also how we will utilize the data nationally and internationally to understand data as it relates to frameworks of care.
The next level of reporting is also in real time, and it is accessed through the website of Healthcare Environment. I'll go there now. Once you're at the site, you select Survey Management, and this will bring you to the research portal. And whatever manager or director or executive who has access to the reports can enter their username and their password. I'll enter a sample here, and we'll go into my test page. Once within the research portal, you will notice that there is a space to enter an email. This is where the reports will be sent to. The email that's on record will automatically be noted here, but it can be changed to an alternative email if you prefer. The space below the email lists all the types of reports that the administrator may request. Now, there are two general types of reports, counts and bar graphs. Counts are used to see how many responses there are during survey administration. Understanding the counts by unit helps to understand where to provide support. The second type of report available in this research portal includes bar graphs, which generate as soon as the survey closes or in real time. These are bar graph reports which provide the mean or the average score for each level of interest, like unit, ward, department, hospital, or system. Now, the final space at the bottom lists all the surveys used to date. The administrator would select the desired survey and then go to the top and select Submit Query. The bar graph report will then go to the email that's noted at the top of the page.
I trust this presentation has been helpful to understand why and how data will be used and structured according to your model of care. Over time, our understanding will deepen as it relates to outcomes within your model of care, outcomes for both patients, guests, families, and staff. We thank you for your contribution in deepening this understanding. We look forward to learning along with you and working continually over time to improve outcomes.